on the ambulance service, then that's my contacts that I've had, obviously going to people's houses, and that's the main issue where I've seen a lot of wastage. I think people have got repeat prescriptions and they'll just keep getting them repeated, and they're not followed up by anybody. There doesn't seem a proper management of, is the patient taking it, because most of the time they haven't, and there's bags and bags of unopened tablets in the houses that I go to. They're not, some of them aren't aware of what the medication's even for.
We know that residents in our area are taking up to 22 prescriptions per person per year. We also know that up to half of people don't take their medicines as intended by the prescriber, and more people are living with long-term conditions, which is increasing the use of medicines. Our pharmacists have been working with GP practices to review patients' medicines. We're checking that medication is still needed, we're checking that patients aren't suffering from undue side effects, and we're also checking that patients can take the medicines as they've been prescribed. We've been looking at patients in care homes, patients who've been discharged from hospital recently, patients who take a lot of medicines, and we will be starting to visit patients in their own homes for those that can't visit GP practices. We've been able to make £200,000 worth of savings on medicines waste in the last year, but more importantly we've been able to keep patients safe and improve patient well-being.
But for us, I mean, cancer's got to be the priority, obviously with what's happened to our family.
In 2012, there were more deaths from cancers in Leeds South and East than the national average. To combat this, we are investing in ways to help raise awareness of the signs and symptoms of the main cancers that affect our population. Our top priorities are increasing bowel cancer screening and raising awareness of prostate, lung and breast cancer symptoms. Our bowel cancer screening campaign has been particularly successful in using traditional and social media to promote the test and remove stigma. Based on feedback from the public and patients about what would encourage them to take the test, we are communicating a simple but effective message. These 3 items can save your life.
They should take the kind of contracting, the small scale commissioning down to kind of really community level and think about more creative ways of using budgets, which I think they are doing, like walking groups and smoking prevention groups and mental health. I know they put money into things like Inkwell, which is community art.
People's mental health can have an effect on their physical health, and that they may need more than a prescription for meds. Linking in with other patients in their area and perhaps other community groups can often help with their social needs. Our new social prescribing service will provide a single point of access for health professionals and patients to refer into. They can signpost and accompany to community groups and activities that will help prevent social isolation and supply some peer group support. To link in with our social prescribing service, we've commissioned a voluntary sector grant scheme. This will encourage community groups and voluntary sector organisations to bid for funding in order to support local activities. We know that those communities know what's best for themselves, so we want to support them to provide services to meet their needs.
But yeah, nutrition and the advertising. Stop saying, oh, look how dirty, filthy smokers. Say something positive, direct people, because it's coming from, when you see the NHS, it's coming from a good source. It's like your man with a white clipboard, white smock and clipboard. People will accept that a little bit more, but they don't accept being pointing the finger at them.
Here at the CCG, we are committed to encouraging more people to stop smoking and to access stop smoking services. Smoking is the main cause of preventable disease and premature death, and people are more likely to smoke in our area than the rest of the city. People are well aware of the dangers of smoking, So this year we're undertaking research to better understand why people smoke and what will help them to quit. Armed with this research, we plan to launch a large campaign to focus on the messages that people will respond to.
I think they could be better managed. Some people say, like with mental health, who are sincerely need it, are the ones who don't approach for it, and the people who really need care tend to lack and go get it, where the ones who only need it a bit more superficial are the ones who go out and seek it and get it. So I think there needs to be more people in the community checking on the more vulnerable people in society and helping them at the bottom end of it.
On the side where children are concerned, I think it's lacking in the fact that it's not seen as being as important as the adult side, because the adult side can become dangerous to others, etc, etc, whereas a 3-year-old maybe can't. But I think it's just as important that they're dealt with early intervention, really.
I worked for some years in private nursing homes, and I think a lot were bundled there because there wasn't enough help available for them on the NHS, especially with mental health patients, and the homes weren't ideal for them either. So I think a little bit more care for patients with dementia and Alzheimer's.
As a city, we are redesigning dementia care services for the benefit of our patients and their carers. By reducing waiting times and improving the links between GP practices and memory services, we will be able to provide a more flexible response. Our new mental health framework will help patients better manage their own conditions. It will improve recovery services and ensure there is integration between mental health and physical health care. For children and young people, we're ensuring that waiting times are reduced, working with our partners to make sure mental health services are joined up, and providing early support where this is identified as a need.